Volunteers of America Freedom House program. I am Jennifer Hancock, and I'm the President and CEO here. And on behalf of our board and my colleagues, I want to welcome all of you for this special announcement. We're celebrating a special award today that's allowing us to have an even greater impact here in Clay County and throughout our region. We opened this beautiful Freedom House program behind me just as the U.S. began to face this global pandemic. We could have delayed opening to a time that felt safer, but I want you to know that we made the conscious decision to push forward. We knew that as the pandemic descended on our country and our region, overdose rates were beginning to climb again. We knew we had to find a way to safely open, so my amazing colleagues showed unwavering commitment and opened the doors to women and children in this 24/7 residential program. And my colleagues are truly the inspiring frontline heroes who are making personal sacrifices every day to come in and care for the most vulnerable amongst us. Today we're also surrounded by some of our closest friends and partners, including our VOA board member, Ricky Green, our VOA board committee member and volunteer and artist extraordinaire. I've heard so many of you as you've toured already today complimenting the amazing work of our friend Mickey Thomas. And we're here today in this pavilion of our neighbor, Pastor Buford Hooker, whose church is right here, and we're so grateful for his friendship and support. And they, along with all of our other VOA friends here today, have volunteered, made personal donations, initiated fundraisers like Ashton Farmer, and so much more to ensure that we could begin this mission of hope and healing here. There are too many people to thank, but just let me have a moment to recognize a few. No one does rural health care better than our friends at Advent Health. And I'm so glad that Chris Self, the CEO there, and Randy Kraft and other friends from Advent are here to help us with this celebration. They are truly our closest allies in this work. Together, Advent and VOA, we have an integrated team that ensures our moms and babies get the most exceptional health care. We've already started delivering healthy babies at their hospital, and we simply could not do this work without their partnership. UPS is here today, and they've made a special investment in helping us raise awareness in this region so that men and women know that we're here and that we're committed to serving them. Frankly, part of our work here is disrupting cultural and familial norms, letting people know that long-term recovery is possible here. So UPS, who started making contributions to our programs in Louisville, they became part of this building bridges that we have all been focused on between Jefferson and Clay County. And I'm so grateful that they're here with us today. And we have other bridge builders like Bill Jones from WellCare, who is the CEO there. We have the most exceptional MCO partners. Bill is here representing WellCare. They were one of the first lead gifts for this Freedom House program. We also have Whitney Allen from United Healthcare, and she serves on our advisory council. And of course, Aetna Better Health of Kentucky has been another key MCO partner. Together, we are reducing the prevalence of infants born substance exposed. And Congressman Hal Rogers could not be with us today, but his support and leadership in Washington has been unwavering. And we are joined today by Karen Kelly and Carlos from his office. And we have other friends too. I see our county judge, Johnny Johnson. Of course, we have our mayor, James Ed Garrison. We have our wonderful friend, Hilda Legg from USDA, and our state representative, Derek Lewis, are here. And of course, it is clear that none of this would be possible without our state Senate President Robert Stivers. Not only has he made a significant personal investment in this program, he has been our partner in ensuring that healthcare services here are tied to the larger vision for this community and region. We are proud to be his partner right here in his beautiful hometown, and he knows that what we're doing is much bigger than solving for the addiction crisis. We're creating jobs, creating unity and vision of what is possible, and helping mobilize the economic revitalization of Clay County. And of course, Leader McConnell. For someone who is a little extra busy these days, how amazing talking to the senator in March, right after the pandemic began gripping our nation, and marveled at his ability to maintain a sense of humor in the face of sobering problems. He has the broadest shoulders to manage so many complex challenges for us and for our nation. And in the midst of problem solving, here he is to celebrate with us again today. And even more important, to advocate for our work and for the people of this region. He has ensured that Kentucky receives the federal support we need, like the SAMHSA grant, to aggressively attack the opioid and addiction crisis. So thank you, Leader McConnell, for your driving leadership for our work and for investing in the most vulnerable among us. We are always happy to get to see you and honored that you and your team are our partners. So we're celebrating some very big news today. VOA is one of 3 organizations in the entire nation. That's right, one of 3 to receive a highly competitive SAMHSA award to serve even more pregnant and parenting women who are overcoming substance use disorder. And we do this work right here in Clay County now because of your support. Our Freedom House program in Louisville has received a lot of national attention. We're one of only 7 providers in the entire nation and the only one in Kentucky to receive a certification from the American Society of Addiction Medicine. And this grant is a powerful vote of confidence in our work and in our ability to change lives here in Clay County and throughout the region. And that's our business, changing lives. At Freedom House, we build healthy moms and babies. We save taxpayer dollars by avoiding expensive NICU stays for babies born substance exposed, and we keep families together. What could be more important? VOA and Freedom House are about strong, healthy, and thriving families. That's how we count our success. And with this grant, we will serve another 250 families over the next 5 years here. When we first came to Clay County, we were new. Nobody really knew that much about us. And now I think about how far we've come. We are at home here, and we love our Clay County family. I could not be more excited to show our community that our commitment extends beyond this program, and we're prepared to do even more. Now we're going to partner with UK to study, analyze, and measure the real impact of our Freedom House program. We'll be an ever-expanding part of a holistic solution that integrates people back into the community, ready to contribute and ready to work. Please know that our commitment does not stop with our Freedom House. Just a few months ago, Leader McConnell was here, and he celebrated the opening of our Recovery Community Center with our partners at Access. We are hosting people at our Recovery Community Center every day, even in the face of a pandemic. We've served over 300 people. We've built a bridge so that 80 of them could get into treatment. And with this grant, we will have added a total of 29 new jobs to this community. We are committed to growth, to providing transitional housing solutions, to leading workforce development and being active and engaged in building a healthy and productive future for Clay County and beyond. Just look at the leaders here today. Together, I truly know there is nothing we cannot do. So you've heard me mention some of our key partners here today, and now I have the honor of introducing UK President Eli Capilouto. The University of Kentucky, my alma mater, is an essential partner on this grant, and UK does so much amazing work in this space under the leadership of President Capilouto. The university has grown and evolved under his strong leadership over this past decade. I am truly thrilled and inspired that so much of that growth has been in the area of attacking the healthcare challenges plaguing our Commonwealth. The university's partnership in this grant process is just one more example of the President's commitment to finding innovative ways to lead and his commitment to making UK a nationally known and wonderfully respected research institution. At Volunteers of America, we don't believe in doing something unless it shows sustained, measurable changes in the health and well-being of those we serve, which is why we couldn't have asked for a better fit than UK as our research partner. Please join me in welcoming President Eli Capilouto.
Thank you so much. It is an honor to be here and to be among such strong partners with where it all starts, and I know it's your heart. Ask everyone at UK now as we go through this pandemic. 5 years from now, I want people to be able to answer in the affirmative to the question, did we care? Did we do everything in our power to protect the health and safety of our students and over 25,000 employees? But our commitment does not stop at our campus. We believe we have a responsibility to be the university of, for, and with Kentucky. And so today I'm honored on behalf of all those faculty and staff and students I represent on our campus to celebrate with you. And before I honor these outstanding partners, our pillars, I must say, of our Commonwealth, I want to recognize two of the people that are going to be your partner to help us better understand business work, and we know it will, but how it could work even better. We have to keep our curiosity and our research such that we remain on an ascent. And so I want to point out back here, they're in the hot sun, Kathy Shepard-Jones and Trigger Adams from our Human Development Institute. When you speak about the most vulnerable, that institute, I think for over 5 decades, has answered every call, day or night, to help those who are at most risk and deserve our care. So, Kathy and Chief, thank you so much. I arrived in Kentucky a little over 9 years ago, and I think Leader McConnell had our first meeting about this time 9 years ago. And you welcomed me to the Commonwealth, and you told me about the high expectations that this wonderful state has when it looks to the University of Kentucky. And we've tried to live up to that. And another outstanding partner is President Robert Stivers. And even before I got to Kentucky and his service in the legislature, he turned up for partnerships. It's because of the calls he makes that we have alliances with local hospitals and our Markey Cancer Center. I know personally that when he saw too many people having to make a difficult job at a time when you're fearful and uncertain, to the extent that we could partner and provide care to people closer to home, he's the one that stepped forward and reinforced that. I remember, I don't know how many years ago, I was here when we opened an eye clinic. It's small, but it's a big need, and he wanted us to be a partner, and we're willing to do so. But something that, he doesn't call for much attention for things like this. But one night at a Kentucky Chamber dinner, he asked me if I was going to be there. It's right when the legislature starts their session. So I was in the audience, and I was surprised, just like everyone else, when he said, in the last legislative session, we didn't get everything right. But we did the University of Kentucky wrong. Because they have a commitment to build a facility to tackle health disparities in Kentucky. And they didn't make it through the session. But because of his leadership and courage, we broke ground, we cut the ribbon on a $265 million research building. And one example of what that means, we're trying to make death a beggar in Kentucky. But thanks to Leader McConnell's vision and leadership and championship of what we do, we're one of only 4 states in the country. And this was a highly competitive rank. And the people of NIH will tell you we had the highest score in the country. And it was our commitment to reduce opioid deaths by 40% in 3 years. And that is a steep order. COVID makes it even more difficult, but I want to let you know our researchers, our staff are undaunted. And Leader McConnell, I don't care what issue it is, and I know how full your plate is. You have taken every call, every issue that we think is serious to higher education, especially during this pandemic, and you have made time for us and for all public institutions in the Commonwealth. So I think I can speak on their behalf in expressing gratitude. So I'm honored to be here with two legends, as far as I'm concerned. I've been in Kentucky 9 years. These two gentlemen, the measure of their commitment to their fellow citizens, to their region, to their entire Commonwealth is immeasurable and invaluable. And with that, I have the honor of turning this over to Senator, Mr. President Robert Stivers.
Now you understand why I wore my UK mask today. Truly, thank you, Dr. Capilouto, and he has been a wonderful partner here. And I do remember that 2015 night at the State Chamber with 1,500 of my newfound best friends. But we did fail the university because we funded a law school and not the research facility. Seems something a little wrong with that, and I'm a lawyer. But to this extent, truly, Chris, hospital, wonderful partner, University of Kentucky, president's already gone through all of that. I can't say enough for all the people who are here with Volunteers of America and your all support and the people who have given financial support to this endeavor. So with that, I have to look at their leader, and that's Jennifer Hancock, and we cannot say enough. She was down here kind of mingling around, and I didn't even know she was here for about a year. And all of a sudden, this thing starts blossoming, and I get involved. They give me credit that probably I'm not due, but that credit really goes to her, the board members, all the staff that have come down here from Louisville, and that bridge we have built. So I cannot say enough for her, the university, Chris. You know, I'm even going to say a lot of people don't understand all the partnerships that have been developed through her affiliation. I look back at the judge. Y'all saw that bridge came across? That was washed out. If it hadn't been for the judge, it wouldn't have been put back. And people say, well, what's so big about that? That was only $40,000 worth of bridge right there. So that's what type of collaboration has gone on. And truly to this group, and I look back at Hilda and Congressman Rogers. You know, we've been fighting fights down here against drugs, drug addiction, and what it does and how it impacts our students. I see my sheriff and all his guys over here. We really don't want them to have any deputies. But the reason they have so many is because we have such a drug problem here. And now we're at the point where we are actually fighting it in utero. It's an amazing thing to think about of how far that this epidemic has gone. So to this group, truly, I cannot say enough in the way of thank yous. I have committed myself and some meager finances to this. I think of my mother who came here in 1945, sight unseen, having her master's degree as a dietitian in prenatal and postnatal care with pregnant women that went to the old Oneida Hospital. Sight unseen from Harvard. It's kind of culture shock when you say, Senator, going from Boston to Oneida. But now, some 75 years later, her son's dealing with the same type of issues of early childhood care, post and prenatal. So it's amazing how things come full circle. So to the group, to my friends and family here who have worked so hard and they have collaborated so much with all the entities here, I cannot say any more than a true heartfelt thank you. Now my other duty today is the honor of introducing a person that really doesn't need introduction. But I'm going to look around at a lot of people here who would know a lot of the names if I were to call them off. But here we have with us a person who is the author of The Long Game, who is considered the master tactician in the United States Senate, who sometimes draws the ire of some of his political opponents, but not without respect for his capabilities and ability of knowing the history and the protocols of the United States Senate. At times he's been called the most powerful politician in Washington. And when President, be it Republican or Democrat, looks to consult and talk, they look to this person. Now, I'm not going to sit here and talk about all that, even though I just did. What I am going to talk to you about is 16 years ago, there was a little group of young people that went from Greenbrier Presbyterian Church. Most of Clay Countyans know that church. And at that time, I think Senator McConnell would have been your caucus chair. You weren't the minority leader, I don't think, at that time, but you were still in the leadership, because it was 15 years ago. And there was a group of young men and young women from Greenbrier Presbyterian Church, Charlie Rollins, all that group. Y'all remember that age group. And here, in the busy time of the day, comes walking down the steps Senator McConnell. And he sits down on the steps with a group of about 30 young kids from Clay County. So people can say all they want to about the tactician, power, the influence, the position. But people really don't know Senator McConnell like I do, because I've seen him sit with those 30 kids for an hour on the steps of the Capitol and just talk to them about the history, the practice, the protocol. And so here, as President Capilouto has said, in the midst of everything else going on in Washington, D.C. and the world, Senator McConnell comes to Clay County again to deal with what? To show support and have been an integral part in getting this grant that Jennifer Hancock is talking about. $2.625 million over 5 years to deal with the problem of chemical dependence. So when you think about all the things you hear, all the things you see, be it in the New York Times or the Courier Journal, what you really need to know, and what you really need to think about, is that image in your mind of him sitting there on the steps with a group of young men, 15, 14-year-olds from Clay County, and the fact that he's back here today, thinking about the youth of this state, the youth of this region, their parents, and how far that we need to go in fighting this problem. So with that, I ask you all, please welcome United States Senator and Leader of the United States Senate, Mitch McConnell.
Goodness, thank you so much, Robert. After that introduction, I'm not quite sure what I can possibly say. You all have been awfully kind. We're here really to celebrate extraordinary success. I want to start with Dr. Capilouto. The grant that he referred to that UK got, one of 4 in the country, was how much?
$86 million.
$86 million related to the subject that brings us here today, the largest grant in the history of the University of Kentucky. And I guarantee you they got it because they're really good. Not only is Dr. Capilouto in the lead on issues like that, he also, as you may or may not know, the head of the SEC president. Are you the president of the president? Is that the way that works?
You didn't need to tell everybody.
And when I first walked up to him, I said, I sure hope we're going to have football this year. And he said he thought so. It looked like we were heading in that direction. And then President Stivers, you all are so fortunate to have him representing you in the Senate and being the leader of the state Senate. He has extraordinary vision about bringing all of Kentucky together. And that manifested itself when he ran into Jennifer Hancock, who I must tell you is the most extraordinary leader of a nonprofit I've ever met. And I've been around a while. So Jennifer and Robert, in a sense, got together and married up our state's biggest urban area with Clay County to work on this extraordinary problem that we're here to talk about today. We're in the middle of a pandemic, but that's not why we're here today. We're talking about a problem that predated the pandemic, regretfully, and one that we've been fighting for a number of years, at least for the last decade. No matter who was in the White House, no matter who had the majority, the problem was there, and we were working together to try to get on top of it. I'm more optimistic now about our ability to do that than I was a few years ago, given the resources that have been poured into this effort. The leadership that you've seen on full display here makes me optimistic that we're going to get past this. Now look, the pandemic has made everything harder. We're all wearing masks. That's the right thing to do. We're not going to have a vaccine until late this year, early next year at the earliest. Dr. Fauci has said, in my view correctly, we're not going to shut the economy down again. So we have to work our way through it. We have to work our way through it. And the single best thing that all of us can do is wear a mask and practice social distancing and help us work through this period until we get an outcome. Even though this meeting is not about the CARES Act, I want to brag on Jennifer again for taking full advantage of the CARES Act opportunity that was presented. It won't surprise any of you that she immediately applied for one of the popular PPP loans and received $3.4 million. So she didn't waste that opportunity. These PPP loans, as you know, are the small business loans. Over 50,000 of them have been granted to Kentucky small businesses and nonprofits. 50,000 of them, which has brought in $5.2 billion. And they're really not loans. If you follow the criteria, it's a grant. Oh, but Jennifer didn't stop there. She also shrewdly took advantage through another avenue of about $800,000 through Louisville Metro government through a HUD funding option. She didn't stop there either. Looking at another fund in CARES, she got over $300,000 from a provider relief fund. So is that aggressive leadership or what? Thank you, Jennifer, for your extraordinary effort here to take full advantage of all the opportunities that were out there to help her organization help all the rest of us. And since I'm in Clay County, I would also mention that Clay County, through the CARES Act, received about $6 million for various things that are happening here. So even though we're not here today to celebrate this grant and this extraordinary success, you can't do anything these days without mentioning the pandemic and our collective effort to try to respond to it. So I'm here today to salute Dr. Capilouto, President Stivers, Jennifer Hancock, and this extraordinary grant. And I'm happy at this point to take a few questions if there are any. Okay. That's easy. Thanks a lot, everyone.